Can omega-3 fatty acids help with depression and thinking skills? Depression doesn't just affect mood, it can also make it harder to think clearly, focus, and stay motivated. Some scientists believe that inflammation in the body may play a role in certain types of depression, especially when symptoms include tiredness, slow thinking, and a lack of interest in activities. Research suggests that omega-3 fatty acids found in fish oil might help people with depression, especially those with high levels of inflammation. Omega-3s have strong anti-inflammatory effects, which might explain why they work as a treatment for some people. A group of doctors and scientists at Mass General Hospital looked into how omega-3 fatty acids affect thinking skills in people with depression and inflammation. Researchers tested 3 different doses of omega-3s and compared them to a placebo, which had no active ingredients. The omega-3 supplement used in the study contained 2 key components, EPA and DHA, with more EPA than DHA. EPA and DHA are the 2 main types of omega-3s found in fish oil. But what did the study actually find? First, more inflammation, more thinking problems. People with more inflammation tended to have worse thinking skills. Researchers measured inflammation by testing blood cells to see how much of 2 inflammation-related chemicals, IL-6 and TNF-alpha, were produced. Second, higher doses of omega-3s improved motivation. People who took 4 grams of omega-3s per day felt more motivated. They had more energy and enthusiasm compared to those who took a placebo. And finally, the biggest benefits were seen in people with high inflammation. The people who had the most inflammation at the start of the study saw the biggest improvements in their motivation and thinking abilities when they took the higher dose of omega-3s. But what does this mean? This study supports the idea that omega-3s can help some people with depression, especially those patients with high levels of inflammation. While past research on omega-3s and depression has shown mixed results, this study suggests that higher doses, like the 4 grams per day, may be needed to see the benefits. Many over-the-counter fish oil supplements contain lower levels of EPA, which was the key ingredient in this study. But if someone wants to try omega-3s for depression, they should first check with their doctor to make sure it is the right choice for them. Omega-3s may not help everyone with depression. This study focused on people with high inflammation, so we don't know if it would work as well for people without inflammation. More research is needed to understand how omega-3s could work alongside traditional antidepressant medications. While omega-3s are generally safe and well tolerated, some patients may get stomach upset and be bothered by a fishy taste. Past concerns about omega-3s increasing the risk of bleeding have been largely disproven, but remember to talk to your doctor before taking anything new, even if you are not on a blood thinner. In the future, scientists hope to figure out which other groups of people might benefit from omega-3s and how they can be standardized for use as part of depression treatment. For now, this study adds to the growing evidence that inflammation and depression are likely connected, and that omega-3s could be a helpful tool for some people. Remember to talk to your doctor first for a proper health assessment and personal recommendations.